On a sunny afternoon in the year 2062, a group of old friends sat down for their weekly afternoon tea. They reminisce about the days they spent on a sheep farm while they knit and crochet and sip Earl Grey tea, and bicker about the details of the distant memory of droughts that sucked the land dry and drove them to feed cottonseed to their animals in dangerous amounts. My name is Mabel, and I would like to introduce you to the characters in our story today. We have Edna the farmer, Betty and Glenda the vet and vet student, Shirley the pathologist, Winifred the vet consultant, and myself, your narrator and guide through this woolen tale. But I must warn you, friends, our story today does not have a happy ending. Let me first introduce you to Edna in the year 2002.
Back in the drought of 2002, I had a farm in northwestern New South Wales. In those days, the sheep were fed whole cottonseed with some cottonseed meal over several months. Sheep were dying at a rather slow rate, must have been between 1 and 5 per day, each with different body condition scores. The sheep were fed in small paddocks with some shrub but no other pasture on sandy soil with good water. Hoggets, maiden ewes, and adult ewes were fed in separate mobs. Facilities and husbandry were always very good. Total mortalities may have reached 20% or more. Morbidities were about 30% of each mob, but with marked variation in body condition both within and between mobs. Hoggets probably had higher mortality rates and generally lower body condition, except for the body condition of a mob of young ewes just brought in to feed. I'd say the adult sheep were eating about zero point 0.7 kilos of cottonseed a day. Cottonseed meal was offered in small quantities to various mobs with good acceptance.
Now, given the extent of the problem, Edna immediately contacted their vet, Betty, in order to investigate what might be happening. As they made their way to the farm, Betty quizzed her vet student, Glenda, assessing the clinical and epidemiological findings in order to create a list of differentials. So, Glenda, do you remember what happened?
I do. I remember thinking that it was important to note that despite good husbandry, all sheep mobs were affected. I guessed it meant that animal level differences, like sex and reproductive status, are less likely to be an influencing factor, although there's a chance that hoggets were more affected by whatever is going on, or just got less TLC than mums or the babies. This pointed towards a nutritional problem, or energy deficit, or a low grade infectious disease, which the sheep were succumbing to as the harsh drought conditions dragged on. The latter seemed less likely, as we would have expected to see signs present sooner. There were no reported neurological or cardiovascular signs, diarrhea, lameness, or edema, just the wasting and sudden deaths. So, since we were in drought, nutritional problems is what we started with. The pastures were bare. Edna didn't have any sources of heavy metal contamination on farm. She kept the feed storage area clean and free from moisture, and the shrubs in the paddock didn't sound like anything the sheep were eating anyway. So, the only thing I thought to look up was the effect of feeding an unbalanced diet of 100% cottonseed in sheep and any associated deficiencies. I did that whilst you necropsied.
It was indeed time to conduct further investigation. Betty decided to call in her pathologist friend Shirley to help with the next stage of the investigation.
I remember necropsying 11 sheep. The most outstanding thing I remember from this case were the hearts. Most of them were pale with multifocal fine hemorrhages in the epicardium, but some had spectacular hemorrhages. I still have pictures of them that I show my pathologist friends. The coronary bands were congested, but they still had fat, and one of the sheep had a necrotic heart. All of them had signs that point to acute congestive heart failure. Their lungs were so solid and congested they looked like livers, and when I cut them open, they were filled with frothy fluid. This supported my hypothesis that this was congestive heart failure. Another thing that supported my theory was that there were variable amounts of fluid in their pericardial sacs, thorax, and abdomens. What's more was the fluid was clear yellow to orange color. This linked to the fact that the sheep had variable levels of jaundice, which made me think, was there liver pathology too? I remember the livers being enlarged, congested, friable, and discoloured. If I recall, they were darker, with fine white to yellow stippling. This is a typical presentation of a liver when there is cardiac disease. In the ewe, the gallbladder was normal, which reduced the chance of cholestasis and indicated that she had been eating relatively well prior to death. When we did histopath, it showed central lobular necrosis of the liver, which is indicative of ischemia or damage to the liver from metabolic toxins. I also found that the kidneys were enlarged and had microscopic evidence of brown material, which linked to liver damage. All of the rumens had less contents than expected, and some had just watery fluid in the rumen, but the ewe had a rumen and abomasum filled with cottonseed, and I thought, aha, gossipol poisoning. But two of the sheep were different. The fat around the coronary bands had disappeared, and they had no fat around the mesentery or kidneys. They had little or no condensate in the rumen, and the rumen flora had shut down. This means that they either suffered inappetence due to gossipol or had learned refusal to eat cottonseed.
But alas, if only more of the sheep had learned not to eat the given cottonseed, we would have had a much happier ending for you today. And so, with all of this information on hand, Betty felt more comfortable coming to a surefire diagnosis for Edna.
It was then, based on all the information collected, I decided that this was most likely caused by gossipol poisoning. The toxic compound known as gossipol is found in cottonseed. I told Edna that cottonseed can be used in feed rations of ruminants with no adverse effects if it's only a portion of the diet. This is because of a detoxification mechanism present in the rumen. However, the toxin can accumulate if overfed, as with this case, where it can cause acute poisoning resulting in death. Gossipol toxicosis must be considered any time there is death in animals that have been on cottonseed for several weeks. To confirm gossipol poisoning, we sent samples of tissues including the kidney and liver to test for free or bound gossipol. In our sheep, concentrations over 10 parts per million in the kidneys and over 20 parts per million in the liver suggest excess exposure. Gossipol may be detected in suspect feed, so it would have been a valid option to perform feed analysis, although this is not always possible. Blood samples from moribund sheep were also sent for analysis and came back with elevated liver enzymes, mild anemia, erythrocyte fragility, and elevated cholecytokinin. Signs of gossipol exposure in many animals are related to the effects of the cardiac, hepatic, renal, reproductive, or other systems. Clinical signs are often reduced growth rate, weight loss, weakness, anorexia, and an increased susceptibility to stress. Prolonged exposure can cause acute heart failure and cardiac necrosis. Pulmonary effects, laboured breathing, and chronic dyspnea are most likely secondary to cardiotoxicity from congestive heart failure. The liver is damaged secondarily. Inhibition of a liver enzyme, glutathione S-transferase, can impair the liver's ability to metabolize xenobiotic compounds. Hepatotoxicity can also be a primary effect from direct hepatocellular damage. Hematologic effects include anemia. Death from gossipol toxicity is partially attributed to reduced oxygen carrying capacity of blood and hemolytic effect on erythrocytes. Additionally, gossipol exerts partially reversible anti-fertility effects in male animals.
Now that Betty had a diagnosis, Edna enlisted the help of her trusty vet consultant, Winifred, to find out how to manage her animals that were currently affected, including the babies that she had on site. Unfortunately, Winifred didn't have that best news for Edna, and again I must remind you, friends, there will be no happy ending for you today.
Unfortunately, there was no effective treatment for gossipol poisoning. Therapies like activated charcoal or saline cathartics are ineffective due to both the chronicity and cumulative nature of the toxicity. Recommendations include removing all cottonseed products from the diet of the infected sheep and reevaluating the diet of future mobs. When transitioned properly, sheep can be maintained on a whole grain diet during drought. These whole grain rations also often require supplementation with amino acids and fat-soluble vitamins, particularly vitamin A. Selenium and copper deficiencies can exacerbate gossipol toxicities, so these should be monitored. Prognosis is variable. Animals that were severely impacted continue to die for up to 4 weeks, with recovery largely related to the degree of toxic cardiopathy that occurred. Mild to moderate lesions can be reversible in instances where animals are carefully managed. However, poor weight gain and stress was common in these animals, which made management difficult. Alternating cottonseed with other feedstuffs aids prevention and slows accumulation. Use of cotton varieties with no gossipol gland could have helped, but these varieties were uncommonly grown due to decreased productivity and increased susceptibility to insect attack. When purchasing bulk cottonseed meal, farmers should aim to test the product before incorporating it into their mob's rations. This allows for an estimation of the levels of free gossipol and helps determine which life stages can tolerate the feed, as young ruminants have a much lower tolerance, with greater than 100 parts per million becoming toxic. Supplementation of the diet with sodium selenite can reduce gossipol effects on semen quality. The use of heat and steam during cottonseed processing substantially reduces free gossipol, allowing for the commercial production of cottonseed meal with low levels of gossipol. Also, while the rumen has some detoxifying effects, bound gossipol has the potential to be converted to free gossipol during digestion. Therefore, to avoid toxicity, ideally the availability of both free and bound gossipol in feeds must be considered.
Given the region was experiencing serious drought conditions, Winifred and Betty worked together to inform local farmers of the risks of feeding 100% cottonseed as a supplementary feed. Winifred explained the preventative measures to these farmers to prevent gossipol toxicity occurring in their herds. Likewise, any farmers feeding cottonseed who had noticed clinical signs similar to Edna's mum's were encouraged to seek veterinary advice. And so, my friends, we have come to the end of our story. Or was it a memory? I'm finding my own recollection a little foggy these days. I apologize that we do not have a happier ending to give to you this afternoon, but I hope you learned a valuable lesson. The end.